Second National Council of Health meeting organized by the current administration under the Ministry of Health and Social Welfare. The first was held a year ago in Ekiti State, southwest Nigeria. The 2024 edition of the meeting is hosted by Borno State government in the northeast.
The coordinating minister that is coordinating us very well.
The National Council of Health is the highest decision-making body of the health sector in the country, and the Minister of State for Health and Social Welfare, Dr. Adekunle Salako, sets the tone for the meeting with his opening remarks.
Universal health care coverage by 2030 for us is therefore not just a slogan or a cash phrase, but a commitment that is backed by a robust pathway to deliver on needs in an inclusive, equitable, and evidence-driven manner. The recently released medium-term expenditure framework and physical strategic paper has as part of its key objective to improve healthcare preparedness and revitalize the Nigerian health system. This strategic direction, among other pronouncements and actions of the federal government, clearly demonstrates that the federal government of Nigeria, under President Bola Ahmed Tinubu, is determined to walk the talk with respect to universal health coverage and general improvement of the health status of Nigeria.
This lays the foundation for the speech by the coordinating minister of the Ministry of Health and Social Welfare, Professor Muhammad Ali Pate, who highlights the successes recorded so far in the sector.
A year ago, we started laying out plans and we made decisions in Ekiti. You can say the first year was the year of planning, of preparation. Now we have entered the year, exactly 1 year, of what I will say execution after diligent preparation over the last 1 year. And we have a lot to show for it. And many of you have been part of this effort right from the outset, right from before Ekiti, all through till today. And we have very tangible things that we can say we collectively achieved in collaboration between the federal government, all the state governments, our local governments, our partners, private sector, civil society. The power of collective effort in advancing health of a population cannot be overemphasized.
The host's governor, Professor Babagana Zulum, uses the opportunity to announce the increment of doctors' salary to be at par with the federal government and efforts being made by his administration to improve healthcare delivery across the state.
I'm proud to share that Borno State has taken significant steps towards meeting this commitment. In our recent budget, we have prioritized health infrastructure, increased access to maternal and child health care services, and allocated resources for critical disease control programs. These efforts are part of our broader vision to make health care accessible to every resident in Borno State, especially those in hard-to-reach and conflict affected areas.
1,150 participants attended this year's meeting, with various partners and donors making presentations that they believe will culminate into far-reaching decisions.